Over Memorial Day weekend, we saw lots of community spirit, people adapting to the annual traditions to this year's reality. But we also saw some concerning behavior as well. I want to remind everyone, there's about 2-week time lag between infections and positive test results. As people develop symptoms and get tested, so the numbers we're seeing now are based on what would happen 2 weeks ago or earlier than that. If we want to keep the numbers going in the right direction, we have to keep doing the things as much as possible as far as washing hands, physical social distancing, cleaning down surfaces, doing all of those things that we want to continue to move forward. As the state plan continues on reopening, we have to do our part to minimize the risk of another surge. Knowledge is power. In this situation more than ever. At this point, it's easy to think we've heard all the facts about all the advice. But as we enter this new phase, it's important for us to keep educating ourselves and understanding how the science applies to reopening. Key factors include how many people are in a certain space, how close is your contact with other people, what kind of airflow and ventilation is there, whether it's in your office or a place that you might be going now. How much time do you spend in that space? Each of us must work as the best we can to understand the risks and to minimize them as much as possible. We can all do that by maintaining 6 feet distance and more than that whenever possible from other people, by continuing to wash your hands and clean your surfaces, by wearing a face covering. You can also do it by knowing the risk before you decide where you go, and choosing not to let a space or a situation where it seems risky get too great. That means working from home if possible, and if you're older or medically vulnerable, please follow the Safer at Home advisory and stay at home as much as possible. Reach out if you need support. Call 311, the City of Boston's hotline, and we will connect you to resources. I certainly understand that none of this is easy. It hasn't been easy for the last 3 months. But it's not the time to let up. It's the time for us to continue to be very vigilant in making sure that we take care of our own health and the people around us.